All right, hello, my name is Megan Ryan. I'm a student of physical therapy here at South College. Today, for our first case, we've got Jeremiah. He is 40 years old, and he is coming in with an Achilles injury. He's had it immobilized for 6 weeks, so we're really gonna try to work on some passive range of motion and increasing tissue extensibility. So, because of that, we are gonna use some ultrasound, and kind of for the reasons that I just said, to increase tissue extensibility, promote some tendon healing, as well as address some of the impaired passive range of motion that Jeremiah is feeling. And ultrasound is going to address all of these patient goals and problems. All right, so, hi Jeremiah.
Hello.
My name is Megan Ryan. I will be helping you out today.
Okay.
So we are actually going to get started on some ultrasound.
Okay.
But before we do, I'm going to ask you a few questions just to make sure that using this is going to be safe for you and it's not going to cause any more problems, all right? Okay, so my first question is, do you have any malignant tumors that you know of?
No.
No? Any blood clots that you know of?
No.
All right. Do you have any joint cements and or like plastic in any areas of your ankle?
No.
No? All right. And do you have a cardiac pacemaker or any cardiac problems?
No.
All right. So I've asked him all his contraindications, and from the preliminary examination that I did before talking to him, I saw that he has no acute inflammation, he has no fracture in the area, and I'm not going to be doing any ultrasound over his eyes and over any epiphyseal plates / like growth plates. So we are good to go on ultrasound. Okay, so what ultrasound is basically, I'm going to use this little wand over here. This one.
Okay.
I'm going to put some gel right on the head, and then I'm going to have you lay down. I'm going to apply the gel and apply the ultrasound. It's going to feel a little cool at first because of the gel, but once it gets going, it might feel a little warm, okay? And what we're going to try to do is help you with that ankle flexion and extension. What is normal for this physical agent and this therapy that we're going to be using is just a slight, you might feel a little bit of vibration from the head. You should feel actually a little bit of warmth in the area. But it should not be painful, it should not irritate your skin or be too warm, okay? So, if it does get a little too warm and it becomes uncomfortable or painful, you can just let me know what you're feeling, okay? I want you to communicate with me and just feel comfortable telling me what you're feeling, okay? Because ultimately I want you to feel comfortable and just enjoy this treatment, basically.
Okay.
This is for you to feel better.
Yeah.
Do you have any questions for me?
Nope.
Awesome. Okay, so before we did ultrasound, we assessed the patient's passive range of motion with ankle flexion and dorsiflexion, and then I also took a scale of 1 to 10 on his pain during that passive range of motion. So that's going to be our pre-test, and we're going to test it after and post-test as well. All right, so I'm going to have you lay down on your stomach for me.
Okay.
Good. And then I'm going to place this pillow right under your hips, okay?
Okay.
There we go, thank you. And then this pillow's going to go right under your feet.
Okay.
All right. Are you comfortable?
Yes.
Perfect. And I was wondering, do I have permission to touch the area that I'm going to be doing therapy on?
Yes.
Perfect. Okay. Here we go. Okay, so I've got the patient lying in prone right now, so I have access to her Achilles. And what I'm going to do is put a little bit of gel. Okay. Put a little bit of gel on the ultrasound head. Move her sock for a second. Okay. Some of the parameters I'm going to use are a 3 megahertz frequency, and I'm going to do that because the Achilles tendon is relatively superficial, so I don't have to really go that deep to get the thermal effects. So we're going to be using the 3 megahertz frequency for that, with 100% duty cycle to get the thermal effects of the ultrasound, and the intensity is going to be right around 0.5. Okay, so if she doesn't feel the thermal effects at first, I might increase that a little bit, but I'm not going to go any more than 1 intensity level, okay? So here we go. I'm going to place the ultrasound head on the Achilles first. Does that feel okay?
Yes.
Okay. And from here, I'm going to turn it on while the head is still moving, that way it doesn't burn the patient. So I'm going to do this. Good, the ultrasound is on now. And I'm just going to rub the area. And we're going to perform this for 5 minutes. Okay, 5 minutes has elapsed. What I'm going to do is turn off the ultrasound, turn down the intensity, and then remove the head. Perfect. After I do this, I'm going to check the skin and the area of where I was doing the ultrasound, make sure there's no redness, no swelling, no irritation, and no burning. Once I see that it is good, I'm going to put her sock back on, or his sock back on. And after this, I will then have you get up off the table and sit down again. Good. And since I assessed passive range of motion in a sitting position at first, I'm going to do it again post-test.